Hello, my name is Johnny Park, and today we'll be talking about marijuana. We will be going over the effects, the risks, and the consequences that come along with the use of the drug. So, what is marijuana? Marijuana can be called a lot of different names, but some of the more common names are bud, grass, green, hash, skunk, or weed. So, marijuana is basically dried leaves, flowers, stems, and seed of the cannabis sativa plant or indica plant. These plants contain THC, which is a chemical component that is responsible for many of the drug's psychotropic effects, which are basically mind-altering effects. How is it used? Marijuana can be administered through a joint, which is a hand-rolled cigarette, a blunt, which is basically a marijuana cigar, glass pipes or water pipes, also known as bongs, which you use to inhale the smoke from the burning marijuana, vaporizers, which are more pricier machines, but they extract the active ingredient in marijuana into vapor, which is like a cleaner way to smoke. Edibles, which are eating food with marijuana cooked into them. Effects of marijuana on the brain. When marijuana is administered, the THC passes through the lungs and into the bloodstream where it is carried to the brain and rest of the body. In the brain, the THC acts on specific brain receptors, also called cannabinoid receptors, which is involved in a variety of physiological processes, including appetite, pain sensation, mood, and memory. When the THC overactivates these receptors, it causes the high that people feel. So some of the short-term effects are altered sense, altered time, mood change, impaired body movement, difficulty thinking, problem solving, impaired memory, hallucinations, delusions, and psychosis. Physical effects of marijuana. Because marijuana is commonly administered through inhaling, it affects the respiratory system. Users can deal with similar problems as those of tobacco smokers. Some of the problems are irritation of the lung, daily cough and phlegm, higher risk of lung infection and disease such as bronchitis. It is said that 70% of smoke, which contains 140 different chemicals, are retained when smoking. It also has cardiovascular effects. It causes vasodilation throughout the body, which causes redness in the eye, low blood pressure, and possible fainting and lightheadedness. After smoking, heart rate is increased up to 3 hours, and it may increase the chance of heart attack for those who have cardiovascular issues. Risks and consequences. Damage to the body. As mentioned before, marijuana has many different effects on the cardiovascular and respiratory system. These effects can lead to damage to the organs in those systems with repetitive use. Reduce academic performance. Studies have shown that students who smoke tend to have lower grades and are more likely to drop out of school compared to their peers who don't. Marijuana can affect the attention span, memory, and learning of users anywhere from a couple of days to a week after administration. Reduce life satisfaction. Some research suggests that long-time marijuana users are less satisfied with their lives and face more problems related to family and friends. Mental problems. Marijuana is linked with depression and anxiety. Research suggests that it can increase developing psychosis in people with genetic risk of developing schizophrenia when smoking marijuana. Impaired driving. Marijuana causes impaired perceptual functions, which lowers users' coordination, reaction time, ability to concentrate, which increases the chance of an accident when intoxicated behind the wheel. Addiction. Yes, marijuana is addictive. Marijuana can lead to development of substance use disorder, which is equivalent to addiction. Long-time users who are trying to quit can experience withdrawals such as grouchiness, sleepiness, decreased appetite, anxiety, and cravings. And here are some statistical facts that I found about college students and marijuana. Marijuana is the most widely used illicit drug among college students. 1 in every 22 college students use marijuana daily. More than 85% of college students think that peers used marijuana in the past 30 days. However, only 18.4% of college students actually used marijuana in the past month. In 2015, 38% of college students indicated they used marijuana in the prior 12 months, up to 30% in 2006. And here are my references that I used for today's presentation. And thank you for listening.